Importanteng siguraduhin ang reliable at affordable na supply ng electricity para sa lahat. Dahil pag siguradong maasahan at abot kaya ang kuryente, siguradong maasahan din ang asenso at abot kamay din ang mga pangarap. Ang mga bata makakapag-aral, makakapagtapos at makakapaghanap buhay ng maayos para sa mas magandang buhay para sa kanila at sa kanilang pamilya. And it's not just about uplifting their lives, but helping them achieve their dreams. Kaya ako narito. Kaya ako ginagawa ang best ko. Para lahat may chance, maging the best din para sa kanila.
The ultimate dream will always be to have a better world, not just for me, but for future generations. I want a future where my kids and their kids get to enjoy the things we got to enjoy in our childhood. Fresh air, parks to run barefoot in, nearby beaches to spend our weekends with the family. For me, this is why I do what I do with and for Avoid Is Power. I want to be part of creating and transforming energy that will drive and deliver the world I want for my family. It's not just about cleaner energy, it's also about access to energy, developing livable and walkable cities and enabling safe workspaces where I can be the best version of me. It's tough to think about everything that needs to be done, but together, kayang-kaya natin to.
Para sa mga nanay na nag-aalaga sa mga anak nila.
Para sa mga online seller na nagtitinda upang maitawid ang pangangailangan ng pamilya.
Para sa mga scholars na gabi-gabi nagpupuyat para makapagtapos sa pag-aaral.
Para sa mga mag-uuma nga gapaningkamot para makaon ang tibuok nasod.
For our children and our children's children.
For all of us and every Filipino.
For the country.
For the world!
Any transformation, a massive one at that, is never easy. But we have our collective determination, we have our passion to serve, and we have our drive to do what is good for stakeholders, for our people, and for every Filipino. And most importantly, we have the power. We can do this, and we will.
Ayan. Okay. So, I guess we've already have here, ilan na ba to? Sorry. Sorry, we already have here 18 participants on the call. So, Healthy Friday, 1AP. I hope everyone is feeling well this morning, no? So, today, I am hoping that all eyes are well, and even if I am not seeing so much of everyone's faces here on the call now, I hope your vision of me is clear. To get the ball rolling, may I know if all eyes are okay today? So, you may chat in 1 if okay naman ang inyong mga mata. If no, then it's a 2. You can chat in here in our Zoom chat. Or if hindi ka sure, maybe ang answer mo, no? It's a 3. So, show off answers. Ayan. Hi, Miss Marivic. Wow. Okay. So, I'm seeing here all 1. So, 2020 vision tayo lahat. 1. Okay. Anyone else? Ayan. Miss Flor, 1. 2, no? Yeah, kasi naka-glasses. I have 2. Okay, so thank you so much for that. I hope makaka-solusyon sa atin na ma-maintain ang 1 at ma-resolba ang 2 tsaka 3 during this session. So, join us today for our physical health learning session, no, that will help us take care of our eyes. We discuss, so magkakaroon po tayo ng scientific discussion, no? What are the parts of the eyes and the crucial structure surrounding it. We will also know the common eye problems and kailan ba talaga tayo pupunta sa isang eye medical doctor. We will know more about tricks and tips to prevent the discussed eye problems through preventive eye care. We will wrap up our session with facts and myths on the eyes and vision. So before I introduce our speaker, reminding everyone that this is a safe and healthy space. We value clarifications. So as usual, you can send in your relevant questions by visiting slido.com and enter the code 401-3213 or scan the QR code that is shown in your screen. For those naman na nandito po sa Zoom, you may use your raise hand button and unmute to ask once you are recognized. So we also want this session to be interactive, no? So as our speaker goes through with her topics, it would be very best kapag natatanong na po natin siya throughout the session. So, now presenting to you our speaker, Doc Kat. So Doc Kat is a registered doctor of medicine with a master degree in business administration. So parang very relevant siya sa AP, no? Doctor na businesswoman pa. Ganun ba yun? Okay, so she was an assistant faculty in Ateneo School of Medicine and Public Health from 2015 to 2019. She practiced as an occupational health physician in various companies such as IntelliCare, Active One, Healthway Medical Incorporated, and MC Lab for from 2014 to 2019. She graduated her ophthalmology residency in the Medical City Eye and Vision Institute last December 2022. Everyone, let us give our warm welcome as the doctor is in, Dr. Kathleen Joyce Q. Villafuerte. Good morning, Doc Kat.
Hello, good morning. Yeah. Okay. So, good morning, everyone. Again, I'm Doc Kat, or you may call me Kay. I'm a graduate of the Medical City Eye and Vision Institute just last December. So, without further ado, let me share my slide so that we can start our session. Okay. Okay, so the title of our lecture for today is Eye Health Essentials, A Guide to Better Vision. Okay. So this is just an outline of my lecture. Siguro you may ask, why do I need to study the anatomy, no? Because that's the first one on the list. I'm not a doctor, not even a medical student. Is this really necessary? Well, in a lot of things, for me, for you to understand the function of something, you have to understand also how it looks. So when you understand just the basic understanding of how a body part works, the more you understand why it is necessary to take care of it. So hindi lang yon, also the compliance as patients, the compliance to doctors' recommendations is also increased because you know why you are doing it in the first place. So by the end of this lecture, we are expected to have an understanding of the basic anatomy of the eye and some of the common diseases that are associated with each part of the eye. I'll also give you a basic guide on how to determine if you already need to consult an ophthalmologist and tips on how you can protect your eye and keep them healthy in your own way. And lastly, my favorite part of every lecture is the myths and facts. So we will have an interactive session wherein together we will debunk some myths about eye care and verify some facts about it also. Okay, so let's go to the anatomy now. This is your eye. Normally you have two of them, no? Unless the one is injured. But normally you have two of them. They're obviously inside your head and it's right under the frontal part of your brain. So it is separated from the brain via a thin bone, which I will show you later. Okay. So let's now go deeper. Something I doubt that a lot of you haven't seen yet. This is the inside of your eye. If there's a thing that we can compare it to structurally, it's the coconut. So that's what we usually use to help patients understand the eye better, the anatomy of the eye better. So the coconut, specifically the fresh one, the green one. So it has a shell, it has a meat, and it has water inside. So same as the eye, it has a shell on the outside. If you can see my cursor, so it's here, no, above, below, and actually up to the back part of the eye. So it has a shell, it has a meat. So inside the shell is this yellow part. This is what we call the retina, which I will show you in detail also later. And it has water. So instead of water though, the eye has a gel. We call it vitreous gel. And it's inside the eye. Okay, this one. Now let's go into the details of the most important parts and look at it from front to back. So first up, so what I mentioned earlier, the shell is the sclera and the conjunctiva. Okay, so these are structures that we can see from the outside, no? So the sclera is the white part of your eye, as seen here, and the conjunctiva, as seen here in the smaller picture, in this colored photo, is like a transparent skin that covers the sclera and the underside of your upper and lower eyelids. So it covers not just the sclera, it covers the inside of your eyelids. Okay. So the sclera helps maintain the shape of the eye. Since the eye is a ball or like a ball, the outer shell holds the shape together. So para lang siyang bola, no? So in a ball, there's air inside, but what is responsible for its shape is mainly the outer structure. In addition, it somehow is the front liner of the eye because it is outside and it's tough. So it protects your eye from mild injuries and invading pathogens like bacteria or viruses or even foreign body. So some conditions that mainly affect the sclera and the conjunctiva are the following. We have scleritis or episcleritis that presents either as a total redness or a nodular redness like seen in this picture. Conjunctivitis, which is a very common condition that you may know as sore eyes. This may affect one or both eye and also present with redness associated with other symptoms. Last among the examples that I'm giving to you today is pterygium. I think you might have seen this in some people already. When you see a white fleshy material that looks like it's crawling on the surface of the eye towards the middle, that's what we call pterygium. Another name for this condition is surfer's eye because we see it usually in people who are exposed to the sun, wind, and irritants such as the sand. So surfers have those risk factors specifically. That's why we call this condition surfer's eye as well. Okay. Next, we go to the cornea. So it is a transparent dome-shaped structure in front of your eyes that is hard to see because, again, it is transparent. So you'll only be able to see it when you look at another person's eye closely from the side. Okay? So from the front, you will not be able to see it because it's really clear. What you see from the front is the colored part, the iris. But when you see an eye from the side, you'll be able to appreciate the clarity of the cornea. So like the sclera, it is also a front liner of the eye. So it protects the eye from injuries and foreign invasion. However, the main function of the cornea is refraction. It is responsible for 80% of the eye's refractive power. You may ask, what is refraction? So in simple explanation, refraction is the process of bending of light when it hits a surface. So imagine, normally in space, light travels in a single direction. it travels in a straight line until it hits a surface. So, for example, when you put a pencil in a glass of water, diba, you will not see a straight line. As soon as the pencil hits the water, it looks like the pencil bent or parang putol. So for the eye, this surface is the cornea. So as soon as light hits the cornea, the light bends and it focuses on the retina, the yellow part here at the back. So with this said, any irregularity of the cornea affects how light goes into the eye. So a common condition that has to do with the cornea is astigmatism. So a lot of patients come in the clinic and say that they went to an optometrist and the optometrist said that they have astigmatism. So this is what is affected with astigmatism, no? So astigmatism is when the shape of the cornea is irregular, thus the light scatters, causing blurring. So specifically, mild doubling of vision. So this is when patients, for example, see an eye chart and instead of a V, they see a W. So that's the effect of astigmatism in your eye because the light is scattered and does not focus mainly on the retina. So infections also affect the cornea, especially if it leads to scarring, since the scarring of the cornea may lead to whitening. So as you can see in this picture, at the middle part, especially if the infection or the scarring is at the middle part of the eye, it will definitely affect your vision. No, if it's in the periphery, possibly it might not affect your vision because it's not aligned with your visual axis. But very important, if you have trauma to the eye or an infection to the eye, you have to go to an ophthalmologist for us to be able to determine where the infection is and if it will affect your vision in the long run. So lastly, foreign bodies can get stuck in the cornea in cases of pooing. So sometimes if a patient is unlucky, the foreign body may even go through and through. And that's a major problem that needs immediate surgery. Okay, so now let's go to the next part. Okay, the next part is also a fluid inside the eye, and it's the aqueous humor. So instead of being at the back, this fluid is in front naman. So just behind the cornea up to the level of the lens. So the white here is your lens. So the aqueous humor is produced here in this muscle, no? This is the this is the ciliary body. And when it is produced here, it flows anteriorly, goes in front of your lens through the pupil and goes to the aqueous space, and then drains eventually here at the angles. Okay, so that's the basic production of your aqueous humor. So the production and the elimination of this fluid is a major component of your eye pressure. So a lot of people, they think na yung systemic pressure, yung blood pressure is the same as eye pressure. It's actually not. Okay, so as I said, the fluid inside the eye, the aqueous, is the major component that determines your eye pressure. Okay, so when there is increased production or a decrease in elimination, the pressure of the eye rises. So literally, when there's a lot of fluid inside your eye can harden. Titigas siya, literally, no? Because of the amount of fluid inside. And when there is decreased production naman or increased elimination, so decreased production, walang fluid masyado, or masyadong malakas yung drainage ng fluid, mas malambot naman yung mata. So again, it's just like air inside the ball. So the more hangin, mas matigas. The less hangin, mas malambot. Okay? So some conditions include spillage of infection or inflammatory materials from other parts of the eye. As you can see here, this is the spillage of infection from other parts of the eye. So as you can see here in this picture, This is your cornea, the white part. The lens is back here. So the space in between is your aqueous space, and it's filled of aqueous humor. So you see the little white specks in the aqueous humor. Those are inflammatory cells or infectious cells or infectious pathogens that are suspended in your aqueous humor. Most likely, these infections come from the surrounding structures, again, like the cornea and the lens, or sometimes even more posteriorly, infections from the retina or the vitreous can spill forward and towards your aqueous also. The second photo shows how an eye looks like when there is an attack of a close angle. So again, what is a close angle? As I mentioned before, this is the angle where the aqueous drains. So it surrounds your it surrounds your iris. So that's the angle. And if the angle closes or narrows by means of a lot of things, sometimes the iris is just anatomically forward, no? It pushes forward, so the angle closes. So this can lead to sudden rise of eye pressure. So titigas yung mata because there is less drainage of the fluid, causing intense pain and redness, and eventually, if chronic, can also damage your optic nerve because the pressure, the buildup of pressure inside the eye, compresses the blood vessels that supply your optic nerve. So naiipit yung blood vessels, walang oxygen supply, your optic nerve, so it dies out eventually. That's what we call glaucoma. Okay? So, but in here, in this picture, this is an acute attack, meaning biglang nagsara, and then it manifested these types of symptoms. Okay, redness and pain. Okay, so now let's go to the next part, iris and the pupil. So the iris is the colored part of your eye. Okay, so here, the blue part, or in our race, no, it's mostly colored brown or black. So, and then the hole inside or at the center of the iris is your pupil. So the iris and the pupil are responsible for the amount of light that enters your eye. So if there are any hobbyists out there na who are into cameras, so this is your aperture. Okay, so it controls the amount of light that enters your eye and eventually goes to your retina. So the difference is that the iris and the pupil are always automatic. No, it's not like a camera wherein you can manually adjust how much light goes in through the camera. So in here, it's always automatic. So it can get inflamed as well or infected, and that's what we call iritis. The main symptom here is eye pain that occurs with sudden exposure to light. So why does it happen? Since the iris contracts with light, so when there is light, when there's a lot of light, the pupil decreases in size. Mas lumiliit siya so that not all the light will go through the eye. So when it contracts, when it closes, the iris moves, and that causes the pain. Okay, so when you have iritis, and so for example, if you have eye pain and you notice that the eye pain is more frequent or more observable when there is bright light, so you might have iritis. Okay, so you have to consult for that. Okay, it can also get affected with chronic infection and inflammation. So as you can see here in the following pictures, we call this synechia, this one. The inflamed areas of the iris stick to the surrounding structures of the cornea in this picture and the lens in the other picture. Okay. So now let's go to the lens. The lens is the second most important when it comes to refraction. It is responsible for 20% of the eye's refractive power. The thing with the lens is that as we age, it accumulates water. So normally, like the cornea, it's transparent. No? So when we age, it accumulates water, and when it accumulates water, it causes swelling and hardening. So just imagine, usually we explain this to the patients in terms of, in the context of windows. So for example, meron kang bintana, and the bintana, when it's clean, usually it is transparent, okay? But when it starts to have debris, or when it becomes dirty, nagkakaroon ng tubig, nagkakaroon ng mga dust or buhangin, it eventually decreases in transparency. So that's what happens when to the lens as we age also. So the transparency decreases and the blurring progresses as it decreases its transparency. So when you have cataract, you will notice here in this picture, here, you can see through the pupil that the lens is whitening, or sometimes even browning. If it's very mature, the lens can turn brown. Okay? Another condition is what we call presbyopia, wherein as we age as well, our eye loses its ability to focus on near objects like reading. So I'll show you a video of this later, so you can understand it better, because it's quite difficult to explain with just words. So for now, let's proceed first to the more posterior segments of the eye. Okay. So here again, we have the vitreous gel, as I mentioned earlier. But first off, I just want to show you how ophthalmologists look inside your eye. So we use special equipment like this one in the picture. We call this a slit lamp, wherein you sit and then put your head on a support structure. And then we use a lens, a specialty lens, so that we can get a glimpse of the back of your eye. So just like here in the picture. So the one you see here, the circle, is the optic nerve. And then this surrounding structure is your retina, the orange one. Another way is via indirect ophthalmoscopy, also using a special lens. So what's the point of all of this? Why am I showing this to you? So simple lang po, so that you go to an ophthalmologist if you have eye problems, because only ophthalmologists have these kinds of gadgets and know how to use them. So it's very important to have regular checkups with your ophthas, especially if you have diagnosed conditions, or if you have sudden appearance of symptoms, because it's only us who can see the back of your eye. So some conditions for the vitreous include floaters, which can be a lot of things actually. So literally, how do we explain this? When something is floating in your vitreous, you'll be able to see it. Okay? Makikita nyo siya as something that is floating on your visual fields. Okay? So floaters can be benign because as we age, the vitreous gel liquefies. And those that remain as gel will float in the now liquefied vitreous. Okay? So the gel component is what we sometimes see as floaters. Other things can be floaters as well. For example, red blood cells. So in patients with diabetic retinopathy, so yung mga may diabetes, when they go into the later stages of diabetic retinopathy and your blood vessels collapse or bursts, the red blood cells go to your vitreous and can be seen or manifested as floaters. Okay? Of course, just like the aqueous, the vitreous can also get infected as spillage from other parts of the eye. So let's now go to the retina and the macula. So the retina, as I said earlier, is the film of the eye in terms of camera. No? So it's like the film of the eye, and the macula is the center of the retina. That is aligned with your pupil, aligned with the visual axis. So all the light, when we look at something, all the light that passes through your pupil will go directly to your macula. So that's why the center of your vision, your macula, is where you have the sharpest images. Okay, so when you look at something, pag may nakikita ka, nakafocus ka on one object, that object is usually your sharpest and your periphery is a blur. Diba? Normally, that's how it is naman when we look at things. So the entire retina, including the macula, processes the images that we see. So it's very important that images are focused here. So that's the reason why we give glasses, why we do LASIK procedures, why we remove cataract and insert an intraocular lens after we remove the lens, all just to focus images on the retina. Unfortunately, it is also one of the most vulnerable parts of the eye. So it can be diseased in itself. Pwede siyang masira or ma-injure, especially of systemic conditions. So usually in terms of diabetes, hypertension, and other systemic diseases, the first hit inside the eye is usually the retina. So if you have diabetes and hypertension, very important to have yourself screened even if you don't have symptoms yet. Okay? So the retina, so this is a picture of diabetic and hypertensive retinopathy. So if you can see here, there are small blood vessels that are bursting. You can see aneurysms of the small vessels. You can also see a lot of yellowish debris, which are usually fat deposits within your retina. So this is what happens to a diabetic or hypertensive eye. The retina can also get detached when fluid accumulates behind it due to a number of factors. So in this picture, you can see that there is a detachment of that retina. Okay, so what's behind this detachment is fluid. So sometimes it can be caused by tears in the retina, but sometimes also it can be caused by systemic disease. Okay, macular degeneration naman is an irreversible condition that is common in Caucasians. So wherein the waste materials or the debris from the retina cannot be eliminated normally and it accumulates behind the macula. So this condition is unfortunately irreversible, but luckily, since it's not common in our race, we don't usually see this as a common condition in the clinics. And finally, of course, a number of infections can also target the retina. For example, one of the most commonly and increasing in frequency is HIV or human immunodeficiency virus. Okay, so finally, we have the optic nerve. So this is the only cranial nerve that goes from your eye to your brain. So this is a long stretch of nerve, that goes from your eye up to the back of your brain. Okay. So you can see from this image that the tail of the retina goes through your optic nerve. So as I said earlier, the retina processes the images and the optic nerve transmits the images to the brain. Okay. So as we mentioned earlier as well, the increase in eye pressure can eventually lead to compression of your blood vessels that bring oxygen to your optic nerve. So when this happens chronically and frequently, the nerve eventually slowly dies. Okay, as you can see here, so these tails, it thins out. So when we look at the eye, this is what we see. This is a normal optic nerve, but this is a glaucomatous eye. So you can see the periphery, it thins out. So this is the tail of your retina that goes in through your optic nerve. And then when eye pressure increases and blood vessel is compromised, so this eventually dies out and thins out. Okay. So of course, as ophthalmologists, we also take care of the surrounding structures, not just the eye itself. So we have surrounding muscles and bones. These muscles are important since it is responsible for eye movement. We also have the lacrimal system, your lacrimal gland, and your lacrimal duct or sac. This is where your tears are produced, and this is where your tears drain. So when we cry, the organ produces your tears. It goes to the eye, goes through the conjunctiva and the outside part of the eye, and then drains through our nose. So kung mapapansin nyo, when we cry, parang pag umiiyak tayo and iyak tayo ng iyak, parang sinisipon din tayo. That's because your tears drain through the inferior part of your nose. Okay? And finally, sorry. Okay, again. So, and finally, we have the brows and the eyelids. So, we have an upper and a lower eyelid that are not just merely composed of skin and muscles. There are connective tissues there. There are multiple glands and also fat that compromise your eyelids. And later on, we'll see how these affects our eyes, no, and the common conditions that affect our eye. Okay, so we have reached the end of your basic anatomy lecture. Let's now go to the most common eye conditions that we encounter as ophthalmologists. And I think a lot of these conditions, I'm sure, are already familiar to you, especially as workers who are most of the time in the office or workers who are most of the time in the fields, no? So let's go through each one by one. So conjunctivitis is what we also call red eye, pink eye, or sore eye. So we have different types of conjunctivitis. We have viral, bacterial, and allergic. So from the types pa lang, we already know that not all conjunctivitis actually needs antibiotic. So also, not all eye redness is conjunctivitis. So before, when I worked as an occupational health physician in a lot of companies, a lot of people will go to the clinic and tell me that they have sore eyes. But that's not usually the case, no? That's not all the time the case. So a lot of eye redness is, and not all eye redness is conjunctivitis. So there are other diseases like scleritis, as I mentioned earlier. Hypersensitivity or eye allergies and irritation can also present as redness. And again, as we discussed earlier, close angle attack can also present as eye redness. There are various conditions actually that present as eye redness. But what's important here is that you know how to identify conjunctivitis from those other diseases. So how do we differentiate? So you have to look for these other symptoms. So when you have red eye and it is associated with these following conditions, then that's most likely the time that you have conjunctivitis. So number one is eye discharge. Eye discharge, or parang nana that goes out, that comes out from your eye. You can observe this more especially in the morning or as you wake up when your eye is very sticky and you can't open them because of the discharge. So that's one sign, especially if combined with red eye, that's one sign that you have conjunctivitis. Also, number two is tearing because of the chronic irritation. And number three is foreign body sensation, or what patients call parang mabuhangin, no? Or a sandy sensation. How do we get this foreign body sensation ba? So as ophthalmologists, this is what we look for when you say that you have conjunctivitis, no? We flip your lids and we look at the undersurface. So usually, if you can see, there are multiple bumps on your conjunctiva here, not just here, also on the upper eyelid. So these bumps that we what we call follicles, or in allergies, we call them papillae. So these bumps is what causes your foreign body sensation. So when you open and when you close your eyes, these bumps scratch against your cornea. And since the cornea is a very sensitive part of the eye, because it has a lot of nerve endings, so you will feel this as pain or as foreign body. Okay. So again, in summary, if you have red eye, that is associated with eye discharge, tearing, or irritation, and foreign body sensation. Most likely, that's when you have that's when you really have conjunctivitis, or that's when you can say that you have conjunctivitis. How do we manage this? So normally, it spontaneously resolves within a week. So a lot of times when patients go to us in the clinics, we don't usually give them antibiotics anymore. We just help them, we just give supportive medications like lubricants so that they will feel less of the foreign body. But what's important to remember about conjunctivitis is that it's highly contagious. So you can pass it very easily from one person to another. So we just advise the patients to separate their personal effects, especially if these personal effects they use for their face. So for example, towels, or your blankets, or your pillows. So when you have conjunctivitis, you have to separate those things and not share them with anyone, especially with children. No? What else? So we advise the patients to put eye cover. So when you see patients with conjunctivitis and you see them with sunglasses, it's not because it's maaraw. Okay, it's because we advise them to put on anything that can protect their eye. So sunglasses, or even eyeglasses, or even goggles. We advise them to put those because it reminds them to not touch their eye from time to time. Okay, and if ever they touch their eye, they won't get the full load of the bacteria and contaminate their environment. So, number 3, isolation. If it's feasible, you can still do this, or if your time permits, you can isolate as well. Especially if you have children at home. Why? Because children are more prone to bacterial conjunctivitis. So, viral conjunctivitis is the most common, but viral conjunctivitis can turn into a bacterial one if it's not managed early, or if it's not if it doesn't resolve, it can turn into bacterial. And children can have bacterial conjunctivitis outright. Okay? And bacterial conjunctivitis is usually more complicated and more difficult to manage. So very important not to contaminate your surroundings if you have children at home. Okay. And last but not the least, hygiene is very important. So we remind patients as well about hygiene, eye hygiene, and hand hygiene. So hand hygiene, hand washing, very important. When you have conjunctivitis or even other infections of your eye, when you touch your eye, always wash your hands. Okay, so that dapat ano na yon, automatic na yon. Always wash your hands when you touch any part of your body that is not clean or that is infected, because those infections you can easily transmit to other people. Okay, and not just hand hygiene, eye hygiene as well. So contact lens hygiene, cleaning of your eyelashes regularly is also important, and I will teach you those later.
Doc,
Yes.
question po, going back to conjunctivitis, yung viral, bacterial, and allergic, do they have the same na 7 days na parang they resolve normally in 7 days, or there are particular types that can resolve faster?
Yes. Sorry, who's this? Is this Yan?
Yeah, yan.
Sorry, I can't see who's asking. So very good question, no? So the different types of conjunctivitis have different courses or timeline. So the most common is viral. So that's what the 7 days is. So yung viral is mostly 7 days, and that's actually the one that resolves spontaneously, okay, even without antibiotic. Bacterial is more chronic. So let's say siguro mga 2 weeks, or even longer if not managed abruptly. And then although they have the same symptoms, mas severe yung symptoms ng bacterial. Allergic naman, usually also around 7 days if not managed. But if you manage it with antihistamines, the severity or the duration of the disease can lessen. Did that answer your question, Yan?
Yes po. Thank you, Doc. Follow up lang, Doc. How would you know, or what are the very particular symptoms na it is a viral, bacterial, or an allergic one? How do
Okay.
we identify?
Okay, sige. So allergic, very obvious yun. Allergic is itchiness, di ba? So if there's pruritus, if there's itchiness of the eye, that's most likely allergic. Okay, but you still have to go to an ophthalmologist. Usually when it's itchy, you just take antihistamine for it. If it resolves, good for you. If it doesn't resolve, go to your ophthalmologist. Now, between viral and bacterial, so as I said earlier, they have the same symptoms, but bacterial is more severe. So, for example, if you have eye redness in viral, you will see that the severity of the eye redness in bacterial is more severe. Mas mapula talaga siya, mas nagluluha siya, and very obvious is that the discharge is very purulent, or parang greenish na yung discharge niya instead of just a whitish or yellowish discharge. So when there's green discharge na sobrang thick, that's most likely bacterial.
Thank you, Doc.
Okay. Okay, so when do you consult if you have conjunctivitis? You consult if it doesn't resolve in 1 week, or if it's progressive, no? So you consult for possible antibiotic treatment, or if you need antihistamine eye drops for allergic types. And also for eye lubrication, although you can buy this naman over the counter, but it doesn't hurt if you go to an ophthalmologist just to confirm if you really have conjunctivitis or other more benign diseases. But eye lubrication you can buy over the counter if you just need relief from foreign body sensation and the irritation. Next, we have error of refraction. So this is one of the most frequent eye problems that prompts consult to an ophthalmologist. So, na-mention ko na kanina yung astigmatism that is determined by the shape of your cornea. And what we haven't mentioned yet is yung myopia or hyperopia, which is determined naman by the length of your eyeball. So we have myopia, which is nearsightedness, wherein the eyeball is too long. Okay, and then hyperopia is farsightedness, wherein the eyeball is too short. Okay, so no need to discuss the details of this. Just know that there are 3 types, and if you have glasses or if you have blurring of vision and the only problem you have is error of refraction, you still have to know if you are nearsighted or farsighted or astigmatism, because those 3 things require different types of glasses. Okay? So, what are the symptoms of error of refraction? It's very simple. Blurring of vision is number 1. If you have far or nearsightedness, and if you have astigmatism, you can also have halos around lights, kasi nga the light is scattered when your cornea is not smooth, no? So halos around lights and scattering of light, especially at night. So for those astigmatics na hindi corrected yung astigmatism nila, usually they complain of driving at night, and then yung mga ilaw from the other cars parang may glare, para siyang nagtitwinkle, or parang may halos around the lights, no? So that's what happens usually with eyes with astigmatism. So how do we manage this? Simply by eyeglasses, no? Contact lens can also help, and laser surgeries can also help, which is very patok these times, because pamura na ng pamura yung mga laser surgery because ang dami ng competition, and a lot of eye centers actually do laser surgery nowadays. Okay. So next is dry eye disease, very common in office workers, especially those who are in front of the computer or in front of their cell phone 24/7. Di naman 24/7, but on working hours. Okay? So what happens in dry eye is that you either have a decreased quantity of tears, or if you have normal quantity of tears, you have poor quality of tears. So how does this happen? There are a lot of factors that can contribute to dry eye disease, including medications. So certain medications, a lot of medications actually, especially steroids, some heart medications, allergic medications, but most importantly, medications for the eyes. So yung mga eye drops, if you have eye drops that you use for other conditions of the eye like glaucoma, those eye drops have preservatives, and those preservatives severely contribute to dry eye. No? Previous eye surgeries can also decrease the quantity of your eye or render your tears poor quality. So previous eye surgeries like cataract surgeries, LASIK surgery, so those surgeries, because it has incisions, it damages the nerves of your cornea. So when your cornea is, when the corneal nerves are damaged, the sensitivity of your cornea decreases, and that causes less blinking. And with less blinking, hindi na nawawash yung surface ng eye natin with our tears. So that contributes to dry eye as well. So other eye conditions like thyroid, hyperthyroidism of the eye. So when we have hyperthyroidism, sometimes we see the patients as parang nagluluwa yung mata, or parang lumalabas yung mata from the socket, no? So that's one effect of hyperthyroidism in your eye. And when this happens, when the eyelids close, hindi siya fully close. Okay? So a part of the surface of your eye remain exposed to the environment, and this causes dry eye as well. Contact lens wearers are more prone also to dry eye. Some skin diseases like psoriasis or eczema, if you have those skin conditions, most likely you are more prone to developing dry eye. Some systemic diseases as well, like what I've said earlier, and their environment, no? So if you have environmental factors, for example, yung position mo sa office is nakatapat sa aircon, or your surfer instructor and you are exposed to quite a lot of wind or irritants, so you're more prone to dry eye in those cases. Okay. So some symptoms of dry eye disease include the following. So burning sensation, mahapdi siya kasi nga there's no moisturization of your cornea. Intermittent blurring of vision. Why do we say intermittent? Intermittent meaning malalabo, tapos the next time wala na ulit, tapos lalabo ulit. So when the eyes dry out, it usually causes blurring, especially if it's the center of the cornea that is dry. But when you blink, as I said, blinking refreshes the tears over your eye. So when you blink, namo-moisturize yung surface ng eye, nagiging clear ulit yung paningin natin. So intermittent blurring of vision. So you have watery eyes as well when you have dry eye. So you may ask, Doc, parang ironic naman yun. Why do we have watery eyes? Dry nga siya. So that's the question of a lot of patients, no? So when you have dry eye, of course, the tendency of your eye, because it's irritated, because it's chronically irritated nga. So your brain will tell your lacrimal gland to produce more tears. Okay? So when your eye is irritated from dry eye, you produce more tears, causing your watery eyes. Okay? That's how it happens. So light sensitivity as well, because the cornea is not smooth, so the light scatters, and foreign body sensation as well. Okay? How do we manage dry eye? Number one, and very important, is determination and elimination of the cause. So if you have a systemic cause or if you have an environmental cause, you have to eliminate those things, because no matter how much eye drops you put in your eye, if you have the systemic risk factor, for example, you have psoriasis and hindi mo ginagamot, you don't go to the doctor for it, even if you use dry eyes, if you use eye drops for your dry eyes, eventually it will go back to its dry eye state because you have the triggering conditions. Okay? So hygiene is also very important, no? So as I mentioned earlier, yung lids natin, it has a lot of glands, and those glands help in the production of your tears. So when those glands are blocked, kunwari, marami siyang debris, yung parang may nakikita tayong dandruff sa eyelashes, no? And those debris block the glands. So it will cause dry eye because there is no enough tear production. So hygiene, very important as well. What we usually do is we use a cotton bud to clean the tip of the eyelash. Not the tip, but the root of the eyelash, kung saan siya tumutubo. So you use clean water and gently brush the root of your eyelash just to remove some debris in there. But you have to be very careful as well because that can cause trauma to your cornea, which we don't want really kasi that's a more complicated problem. So just clean your eyes very very carefully, and that can help maintain the moisturization of your eye. And lastly, lubrication. So eye drops, what we give to the patients is usually just an artificial tears. So because nga you don't have enough tears, we give artificial ones. Okay. Astinopia or eye strain is also very common in office workers or in any worker doing near work. So how does this happen? So astinopia is also called computer vision syndrome or digital eye strain because nga it's commonly seen in patients who are near workers or yung mga nagtatrabaho na malalapit. So halimbawa, mga writer or proofreaders or computer workers, no? So what happens with eye strain is that when we are focused on a near object, our muscles are contracted. And pansin nyo, pag mas malapit yung tinitignan, yung eyes natin is mas crossed. Okay? Mas malapit, mas crossed. And when it's chronically in that state, kung halimbawa, you're doing near work nga and your eyes are chronically crossed, na papagod din yung muscles ng mata natin. So just like any other muscle of the body, the muscle of the eye also drains out. So it fatigues, and when it fatigues, we call that eye strain or astinopia. Napapagod yung mata, nagbo-blur din yung vision kasi when it's pagod, it drifts. Okay? Instead of focusing on the near work, pag pagod na yung muscles mo, nagdi-drift yung eye natin. So parang lumalabo yung vision because we are not focused on the thing that we are focusing to. Okay, so some symptoms of astinopia include eye pain, or not necessarily eye pain, but more on discomfort, parang pagod, parang bugbog yung feeling ng mata. We have headaches, especially tension headaches or cluster headaches that are not necessarily headaches na malapit sa eyes, no? Sometimes we can feel it on other parts of the head. And blurring of vision as well, because as I explained earlier, our eyes drift and we can't focus on the thing that we are supposed to focus on. Okay, so how do we manage eye strain? We manage this by limiting screen time. That's the only way. No, you limit your screen time, because without it, what else can you do? We don't have any medications for eye strain. No, only rest. We also have the 20-20 rule, and this is somehow our gold standard when it comes to resting your eyes if you have eye strain. So how do we do the 20-20-20 rule? Okay. So the 20-20-20 rule is like this. So every 20 minutes, so yung mga office workers dito who are in front of the computer, you have to listen to this very carefully and take this into heart. Okay? So every 20 minutes, take a 20-second break. So 20 minutes, 20-second break, and look at something 20 feet away. Okay? So again, what causes asthenopia is your chronic looking at a near object. So how do you manage that? Is by looking at something far away. So every 20 minutes, no matter what you're doing, as long as it's near work, take a 20-minute break and look at something 20 feet away. Okay? Parang pinupush-ups mo lang yung muscles mo around your eye. Okay? Next is hordeolum, or what we call stye or kulite in Tagalog. No? So this is an infection caused by inflamed oil glands in your eyelids. So this inflammation causes the opening of the glands to swell, leading to trapped bacteria and debris. So just to make this clear, so here's a sample picture. So this is your eyelid. As I mentioned earlier, it's not just composed of skin and muscles. There are a lot of glands that live in those eyelids, no? So if it's in front, or if the bacteria targets the gland in front of your eyelids, which is where your eyelashes come from or grow from, that's what we call anterior hordeolum, or external hordeolum, or nasa labas, external. But when it affects the inside part of your eyelid, we call that internal hordeolum. So what are the symptoms of hordeolum? Nodular mass. So there's a mass, kulite nga no? Para siyang pigsa but nasa eyelids. So there's a nodular mass, that there's a redness and there's swelling that is painful to touch. So that's what it means when we say tender. So when we say tender, pag hinawakan mo yung something, any body part, in this case, the eyelid, when you touch it, it's painful. Kasi nga, it's inflamed, it's swollen. So when you touch it, masakit. So this can happen with or without discharge. No? Most of the time, there is a discharge, because just like pigsa, meron tayong tinatawag na mata when it comes to hordeolum. So that mata is where the discharge comes out of. And without this mata, hindi siya magde-drain. So sometimes walang mata, and we manage that differently. Okay? So how do we manage it? Very important, more important than all the other medications or all other antibiotics that we put in the eye. When we have hordeolum, warm compress is very important. So what does warm compress do? Di ba nga, hordeolum is when there is debris and bacteria trapped inside your glands, no? So when you do warm compress, the solid debris and the solid bacteria, it softens it. The warm compress softens it. So once it's soft, that's when we can put medications already, so that it can drain easily. So pag mas malambot siya, especially if may mata, pag mas malambot yung debris na nasa loob, mas mabilis siya mag-flow out of the mata. So that's how also you manage mga pigsa, no? So also by warm compress and antibiotic ointments. Okay? So just want to specify this, that if you have a hordeolum that has mata, we can give you eye ointment for that, an antibiotic ointment, and we don't need to give an oral one because the debris nga can drain. But if you don't have a mata and the debris can drain, we have to give you an oral one because we are fighting the infection from the inside. Okay, so here's the presbyopia. As I mentioned earlier, I'll show you a video of this. So this is the condition wherein our eyes, as we grow old, no, sometimes this starts as early as 35 years old, our eyes loses its ability to focus on near objects. So here's the video. Please look at this first. So accommodated means that the eye is doing near work or tumitingin sa malapit. So when the eye is accommodating or may malapit na tinitignan, as you can see here, this muscle contracts and then it pulls, muscle contracts, so kumakapal siya. And yung lens natin, ulitin ko ha. And yung lens natin kumakapal. So muscle contracts, the length of your lens from anterior to posterior or from front to back, kumakapal siya, no? So that's what happens when we look at something near, okay? So when we age, the ability of our eye to do this decreases, okay? So primarily, this is due to aging. As early as 35 years old, some patients already need reading glasses, no? But most of the time, this starts at around 45 years old. So the symptom is primarily difficulty with near work like reading, using cell phone, and etc. So mapapansin nyo, the older generation, when they read, if they're not wearing reading glasses, when they read, or for example, yung glasses nila is for their farsightedness, they have to remove the glasses and then nilalayo nila yung binabasa nila. That's because nga the eye can't focus if it's near. So ilalayo nila and that makes the object clearer. Okay? So how do we manage this? Simply by reading glasses. That's the only way. There are no surgeries for presbyopia. Okay. So lastly, we have trauma. Okay? So, excuse me. So we have different types of trauma as well. We have major ones and minor ones. So a major trauma, for example, is a penetrating injury. So what we do for these types of trauma, do not remove the object. Okay, very important. If there's a foreign body stuck in your eye, don't remove it by yourself. You have to protect your eye to prevent any more damage and go directly to an ophthalmologist so that we can see the extent of the damage and we can plan on how we will be removing it. No? Sometimes a small foreign object, especially in the cornea, we can just scrape it out. But if it's a big object or if it penetrates inside your eye, we have to do it via surgery. So how do you protect your eye when you have trauma? So you have to use a rigid eye shield. So may matigas na nakapatong dapat sa mata without moving the foreign object. Okay? So minor trauma naman, like pooing, the first thing you have to do is wash with running water. Running water, or as long as it's clean, no? So although that can be difficult kasi sometimes you can put your eye naman under a faucet. So what I usually tell patients, if napuwing sila, just get a basin of clean water, and then submerge your face in it, and close and open your eyes for a couple of times, just to remove any debris from there. If there are any foreign body that's still there, and you can still feel it, then you have to go to an ophthalmologist again. Or even if you don't feel it anymore, you still have to go to an ophthalmologist just so we can see if there is an abrasion on your cornea. Okay, so in these cases, you have to avoid pressure over your eye or avoid manipulation. That's why you also put the cover to remind yourself na you shouldn't manipulate your eye or touch your eye even. So this is the different types, no? Mukha lang siyang nakakatawa, but this is really how we want patients to do it. If your eye is injured, whatever type of injury, no? Burns, or foreign bodies, or nasuntok ka, blunt injury, this is how we want you to protect your eye before you see an ophthalmologist. So you cover it with a rigid eye shield, or if there is a more, a bigger foreign body that's sticking out of your eye, you can cover it with the cup bottom. So this is a plastic cup, nilagay lang niya over the eye and taped it, no? So I believe there are field workers here, field engineers, no? Very important when you're on site, when you're on field, you have to wear protective PPEs when you have a lot of things that can injure you, no? So wear your PPEs, but when the time comes, for example, hindi napigilan, nagkaroon ng injury, protect your eye at all costs. Do not manipulate, and go directly to an ophthalmologist. Okay, when should I consult an ophtha? Ang dami nating pinag-usapan na common diseases, but in all these cases, do you have to consult an ophthalmologist? If you have new symptoms, do you have to consult an ophthalmologist? So the following tips are just guidelines, no? So that you know when you should really go to an ophthalmologist. Number one, it's always best to consult an ophthalmologist every time there is an eye concern, because as I said, there are equipments that only ophthalmologists can use. So serious conditions can sometimes manifest with simple symptoms, no? So medyo bibilisan ko na because we only have 20 minutes left and we still have 2 parts remaining. Okay? So when there is a severe and or abrupt symptoms, or if there is progress or no improvement despite interventions, or if there is recurrence of your eye problem, you have to consult an ophthalmologist. So unfamiliar or new symptoms. So if you have floaters, especially if symptoms that relates to the back of the eye, like floaters, visual defects, or like parang may parts of your visual fields na nawawala, you should consult an ophthalmologist. Change in color intensities or flashing lights, those are usually signs of an injured optic nerve or an injured retina. Okay, next, physical changes in the eye. So you always have to look the symmetry of your eye. Pantay ba siya? Is there swelling on the other eye? Is there pterygium on the other eye? Anything that is growing on the other eye and is not on the other one? Eye deviations or mga cross eyes or nagbabanlag, no? Whitening of the cornea, masses, especially peculiar ones or newly formed ones, o yung mga tumors na namumuo sa mata. Kahit maliit pa yan, as long as it's growing very progressively and rapidly, you have to consult an ophthalmologist. So again, for all traumas, go to an ophthalmologist. Whether it's a minor or a major trauma, you have to go and you have to get yourself checked. So foreign bodies, burns, chemical injuries, blunt traumas, pag nasuntok ka or may tumama sa mata mo, and penetrating injuries using sharp objects. And lastly, systemic diseases. So if you have systemic diseases that can affect your eye, like diabetes, hypertension, thyroid problems, or if you're immunocompromised, especially if you have an immunocompromised state such as HIV, AIDS, yung mga ganon, you have to consult an ophthalmologist early on, because these injuries to these conditions to your retina are irreversible. So walang mawawala if you get yourself screened early on. Okay? Okay, so let's now go to the tips on how to keep your eyes healthy. These are tips that you can do um, by yourself, no? Kahit hindi kayo pumunta sa OFTA, these are how you can do preventive measures for your eyes. So number 1 is regular and comprehensive eye exam. So always remember this phrase, no? Structure before function. So in a lot of eye diseases, especially in more posterior ones, yung mga nasa likod na structures, the problems start with anatomical changes first before it manifests as a symptom or before it alters the function of your eye. So sometimes may damage na pero hindi mo pa napapansin. That's why it's important to have your eyes regularly checked. Okay? Number 2 is change in lifestyle. So, number 1, kalaban ng eye doctors is smoking because there are a lot of conditions associated with smoking. This is a risk factor for dry eye disease, especially with the smoke. It's an irritant, so it can chronically irritate your eyes, no? Smoking is also very much associated with macular degeneration, which is reversible. Okay. Also, when you're smoking, it's most likely diabetes and hypertension also. You can change this. This has to be under here on eating right, no? So maintain your blood sugar level when you have diabetes. Decrease salt intake if you have hypertension. So I'm sure you know if you're affected with these diseases, you already know what to eat and what not to eat, no? So lutein is the main vitamin for the eye. So you can find this in green leafy vegetables. However, lutein is not something you can take to improve your vision. Okay, it's there to prevent potentially prevent damage to the eye or to maintain your vision. But if you already have a problem in your eye, no matter how much lutein you take, it will not recover from whatever condition you have. Okay. Know your risk factors, personal risk factors. If you have underlying diseases, you have to know that. Again, if you're a smoker, if you have use of medications or drugs that can affect your eye, can lead to dry eyes, you have to know those risk factors so you know what to expect from your eyes. Okay, family's eye health history is also important. If you don't have diabetes yourself or hypertension yourself, ask your family members. Maybe they have those things and you're more prone to having those things as well, especially if your family members have the same eye conditions, no? Or if they have eye conditions that can be passed on to you. Okay, so practice regular eye hygiene as mentioned earlier. Hand washing is very important. Contact lens hygiene is very important as well. Never sleep with your contact lens on. Okay, clean your eyelids and lashes every day, twice a day, morning and night, as I instructed earlier. Okay, this one, wear sunglasses, wide-brimmed hats, and lotions with SPF. How do these protect your eye? So sunglasses protect your eye by limiting the ultraviolet light that goes in through your eye. No, so it delays also cataract development because nga of the ultraviolet exposure. So hats and lotions protect your lids and the surrounding skin from certain types of cancers and other problems. Okay, very important. Give your eyes a rest. For workers, office workers like you, always do the 20-20-20 rule and limit your screen time. If you're at work and 8 hours ka nang naka-computer, pagdating mo sa bahay, rest your eyes, no? Very important for you. Practice safety in the workplace, in operating vehicles, and when doing sports and hobbies, no? For our field workers, if you are at the field, wear your PPEs, chemical handling and carpentry, and when you're in welding, you should also take note of those factors when wearing your protective equipment. So in vehicles, no, if you're riding motors, wear your helmet and your goggles. For sports and hobbies, especially if there's something that could hit your eye, like badminton or tennis or golf, protect your eyes and wear appropriate eyewear. Okay, so regularly test your eyes one eye at a time. So this one is just an addition. Okay, kasi I've noticed in the clinics that when a patient comes in, sometimes very late na in the course of the disease. And then when we ask them, bakit ngayon lang kayo pumunta? They say na, ay doc, hindi ko po kasi napapansin na malabo na pala siya. So, the other eye, the healthier eye compensates kasi for the other eye most of the time. No? So even if, kunwari, lumalabo na ng paunti-unti itong kanan, yung kaliwa mo nagko-compensate dun sa kanan mong mata. So it's important to regularly check your eyes, no? One eye at a time, just so you can see if there are differences in its function, no? Not just in its anatomy. Okay. Okay, so here we are now in this very interesting part of our lecture. Sakto 10 minutes na lang to go. Yan, can you help me with this?
Sige po, Doc.
Kasi I can't see yung mga chat nila eh. So, just let me know if mas maraming sumagot ng myth or fact. So, what you do is just type in, I will show you a sentence or a statement and just tell me if it's a myth or if it's a fact. Kung totoo ba siya or kung hindi. So, let Yan know via chat and then she'll tell me kung ano yung mas maraming answers. And then, together we will debunk it or we'll debunk it or confirm it. Okay? So, number 1. So, I can just consult an optometrist. No need to go to the ophthalmologist since they do the same things. Okay. Kindly type in your answers. So, I'll count to 5 na lang. So, 5, 4, 3, 2, 1.
Doc, we have a little bit more of saying myth, pero almost same lang po yung nag-answer ng fact.
Ng fact. Okay, sige. So, myth and fact. So, buti na lang sinama natin to, no? So, the answer is, it's a myth, okay? So, although optometrists and ophthalmologists kind of do the same things because optometrists specializes in error of refractions. Yung grado lang sa mata, no? So, basic eye problems like dry eye diseases, so error of refractions nga, so myopia, nearsightedness, farsightedness, presbyopia, astigmatism, they specialize in those and they specialize of the measurements of your grade, no? Ophthalmologists, on the other hand, is the eye doctor. Doctor talaga, we do surgeries, we manage your condition, we prescribe you with medications. Although, we work hand in hand with optometrists, and actually, they're a very big help to us. It's just that there is a deeper level of understanding when it comes to eye diseases and how it works for the doctors. Okay? Next. Ito, very, very controversial because this is always asked every time. Walang palya if I get an office worker that consults in the clinic. So, blue light damages my eye, therefore I need anti-blue light glasses. So is this a myth or fact? Okay, 5, 4, 3, 2, 1.
Funny, Doc, no? Because the answers coming in is a myth, a fact, a myth, a fact, a myth.
Ah, talaga?
The
Okay.
balance number.
That's what I like about this session kasi talaga, marami talagang patients or maraming tao na naniniwala talaga sa mga ganito. So, in every opportunity, I try to correct these understanding, no? So again, it's a myth, okay? So blue light, it passes through your eye, but it does not injure the eye itself. Unless, of course, there's an enormous exposure to damage your retina. But normally, when we look at computers 24/7, the blue light that passes through our eyes is not enough to injure our eyes. So what does blue light affect really? Bakit ang dami-daming nagsasabi na kailangan nyo ng blue light, ng anti-blue light filters with your glasses? So this is the reason. So blue light actually affects the chemical melatonin in your brain. So the eye is just a passage, no? So when you get blue light from your gadgets, it passes through the eye, goes to your brain, and it affects melatonin there. And if you're familiar with melatonin, melatonin is the chemical for sleep. So it helps you sleep regularly. So that's why mapapansin nyo, pag matagal kang naka-cellphone bago ka matulog, hindi ka inaantok. Okay? That's because the blue light is altering the melatonin in your brain. So do I need glasses for this? No. Normally, if we are just normal people, we don't need the glasses. Except, of course, there are exceptions. No, if you have prolonged digital near work or digital work with computers or cell phones, and you need to stabilize your sleeping pattern. So, kapag talagang wala kang magawa, you are 24/7 exposed talaga sa cellphone, sa computer, and sobrang hindi na smooth yung sleeping pattern mo, then that's when you can consider having anti-blue light glasses. So what can you do instead of purchasing blue light filter? So these are things that you can do just by yourselves, no? So limit e-devices 2 hours before bedtime. You can use dim light during bedtime hours, no? So pwede naman yon, magbasa ka in dim light, it's okay, it will not walang problema doon, it will not damage your eyes. And number 3, I'm not sure if a lot of you know this already, but there is an anti-blue light for your devices. So nakagamit na ako ng Apple and ng Samsung devices, pareho silang may anti-blue light filter. So sometimes it is worded in a different way. So meron minsan, I think sa Apple ang nakalagay night shift. You can even adjust the schedule. So ako yung sa akin, ang schedule ko is from 10 p.m. to 7 a.m. Naka-on yung night shift ko. So that is, dinidecrease nila yung blue light emission of your gadgets. Kaya mapapansin nyo, the screen is yellowish kasi wala yung blue component. Okay?
Doc, if I may ask lang, would you know what are the year of production of those devices na may blue light, anti-blue light feature?
Sorry, ano yun?
Would you know po kung ano yung year of production generally ng mga devices na may ganyang feature? Blue light.
Actually, hindi But the more, actually yung mga ginagamit natin ngayon, the smart ones, the smart devices, halos lahat sila meron, even the older ones. Basta yung smartphone.
Nice. So, pwede pala i-check yon kaysa sa parang,
Oo.
in my experience, no, buying or having my glasses replaced, it's an additional cost if magpapalagay ka ng blue light something layer. So, ayun, hindi na tayo magpapabudol. Yes po,
mahal siya. It's not cheap. Mahal siya. So yun, kung di nyo naman kailangan, you don't really need it. You don't have to have it. Okay? So there are things you can do on your own to limit your blue light absorption. Okay? So next. So my eyes will eventually blur when watching too close to the TV, using my cell phone, or watching computer. So is this myth or is this a fact? Okay, again, 5, 4, 3, 2, 1. Parang dalawa lang. Ayan, 4 sumunod.
Okay, so out of our answers, no, most of them, 99% are fact and we have 1
myth. Okay, sige. So, the answer is, it's a fact. But, tama din yung sumagot ng myth. Why? Because the blurring here is irreversible. So, irreversible blurring, ibig sabihin lilinaw ulit. because the blurring is only due to dry eye syndrome or asthenopia or eye strain. So as we mentioned earlier, watching too close to something will not cause any injury to your eye, but it will cause dry eyes. Kasi nga, when we focus on a near object, we don't blink. If we don't blink, our eyes will dry, but if we blink after that, lilinaw siya ulit. Okay? Or, when we focus too near on an object, our eye muscles fatigue, and that causes the eye strain. And when you have eye strain, nagdidrift yung eyes, nagiging blurry siya because we can't focus. But then again, if we rest our eyes, babalik siya sa normal niya. And it will be, the blurring of vision will be irreversible. Okay? Next. Konti na lang to. 2 minutes na lang, pero okay, konti na lang. Pulling eyelash in a sty can help drain its contents. Pag wala siyang mata, na sinabi ko kanina. If you pull an eyelash, will it help drain the contents? And will it speed its recovery? So, sige. 5, 4, 3, 2, 1.
All says myth. And one came in saying it's a fact.
Okay.
Ano ba to, Doc? Ito yung ito yung misconception ng mga bata tayo. That's why we pull it.
Yes. Oo. So sabi kasi nila, when you pull it out, doon magde-drain yung pus. 'Di ba sabi ko kanina, yung glands natin, merong drainage yan, nabablock siya kapag meron tayong hordeolum or kulite, kaya hindi nakakalabas yung yung debris. So you have to understand that the mata or yung drainage nung gland is different from where your eyelash is growing from. So hiwalay yun. So even if you pull out an eyelash, hindi siya konektado doon sa drainage ng glands mo, ng eyelid glands. So kahit may debris doon, nag-pull out ka ng eyelash, hindi pa rin yun lalabas. Okay? And actually, pulling an eyelash can increase bacterial load kasi merong open areas yung pinagbunutan mo ng eyelash, and infection can go through there, can go in and worsen your infection. Okay? Next. Having a 20/20 vision means that your eye is healthy and in perfect condition. Okay, 5, 4, 3, 2, 1.
Okay, most of our answers are myth.
Okay.
And we have 2 saying it's a fact.
Okay. It's a myth. Okay? Why? As I said earlier, structure before function. So sometimes we have 20/20 vision, we don't know. Meron na palang nangyayari sa mata natin inside. No? 20/20 vision means you have perfect vision, but doesn't mean that you don't have a damage to your eye. Okay? So, yun lang. Next. So, wearing eyeglasses with the wrong grade will not damage my eye. So, 5, 4, 3, 2, 1.
Big myth daw po.
Please. Okay. It's a fact. Okay, so wearing glasses na mali ang grado will not damage your eye. Kasi what does glasses do? Glasses is like your cornea and like your lens, no? It bends the light so that it reaches your retina. So it affects the bending of light, but not the eye itself. Okay, so it will not damage your eye if you wear a different grade glasses. It can contribute to some physical symptoms like headache or discomfort, no? Especially if the grade is higher than your actual grade, but it does not damage your eye. And once you remove the glasses, those pain, those discomfort will be reversible. Okay? Next, reading in poor lighting condition will hurt and damage my eye. Ay, parang nasabi ko to kanina. Pero sige, vote pa rin kayo. So, 5, 4, 3, 2, 1.
Sabi dito, Doc, it's a fact, but there's still someone who says it's a myth.
Okay. Tama si someone, no? So, it's a myth. So, minention ko na kanina, no? Na when you read in poor lighting conditions, it will not damage your eye, no? It will only strain your eye, but it will not damage the eye itself. Okay? So, once the lighting conditions are back, then babalik sa original state yung eyes ninyo. No damage caused. Okay, so imagine we have ancestors. Ano bang ginagamit nila Rizal noon? Hindi si Rizal, siguro mas matanda pa. Anong ginagamit nila noon nung wala pang ilaw? How do they read? How do they work? No, in poor lighting conditions. Or even at night, kapag nasa labas ka, nagbabasa ka ng billboard na walang ilaw, 'di ba? Hindi naman nadadamage yung mata mo mismo. Okay? And when the environment is malinaw na ulit or maliwanag na, then nothing serious happened to your eye. Okay? So, next, I think this is one of the last few ones. So, a cataract must be ripe before it is removed. Or kailangan hinog na yung katarata bago siya tanggalin. So, fact or myth? So, 5, 4, 3, 2, 1. Parang walang bumoto. Meron ba, ma'am?
Yeah, there are. Sabi po dito, myth.
Okay, very good. So it's a myth. Why is it a myth? So we have gradings for cataract, no? We grade it from 1 to 4. 1 to 5, pero it depends on the component. So it is a myth kasi even if you are on the lower grades of the cataract and wala ka pa dun sa mga mature cataracts, you can already remove it as soon as it compromises your vision. So it depends. It's very subjective, no? If for the patient, for example, makita namin anatomically yung cataract niya, ay hindi pa ganun kahinog, pwede pa tayo maghintay. But if it bothers them, kunwari instead of 20/20, 20/40 or 20/60 yung vision niya. So if it bothers them, then you don't have to wait, no? Hindi mo naman pwedeng i-torture yung patient na hindi, sige, hintay pa tayo hanggang sa lumabo pa. Kasi it will affect them it will affect their daily function. Okay? I think this is the last. Eating carrots will improve my vision. Okay. So 5, 4, 3, 2, 1. Ay, sorry. Sinagot ko agad. Anong sabi nila?
Okay, so there is a balance. May mga nagsabi na fact and myth.
Okay. So it's a myth. So you have to look at the statement, no? It says improve. So sabi ko kanina, 'di ba, dun sa about sa lutein, the main vitamin of the eye. Carrots naman have vitamin A, which also is a vitamin of the eye. So as I said earlier, when you eat these vitamins and when you intake these foods, it can help you maintain good eyesight, but not necessarily improve when you already have a problem in your eye. Okay, so when there's damage already, it will not do anything. It will only help you hasten the progression. Okay, but it will not improve whatever there is already. Okay?
Ayan, Doc.
That's
May
the
nag-follow up tuloy ng question, Doc, kasi we're
Yes.
talking about vegetables already. How about squash daw po, Doc?
Squash and other things that are orange. Yun nga, carrots, squash. Ano ba yung squash? Kalabasa ba yun? Cabbage. No? Those have vitamin A. So that can help maintain good vision but not improve an already deteriorated vision. So yung lutein naman, we usually get it from green leafy vegetables, and there is actually a vitamin that we prescribe to patients that I can't mention naman, but it contains lutein, no? So that's what we usually give. More than vitamin A, we give lutein for your eyes.
And specifically mentioned here na pa-research tuloy ako, Doc, itong pteridium.
Yes.
Yung parang, yung ginagawang salad, pako ba to siya? Sorry, guys. Yeah,
Pako.
does it improve or help yung ano?
Pteridgium. Hello? Sorry.
Yes, Doc.
Kung ini-improve niya yung pteridgium, yun ba yung question?
No, Doc, that pteridium as a vegetable, tama ba? Can you assist me here, Miss ano? Sorry, it wasn't renamed as well. Viticar?
I'll stop share na so I can see the...
Ito siya, Doc. How about pteridium?
Sorry, ano yun? How about? Ayan. Can I see the question?
Sabi niya dito, Doc, how about pteridium? And when I researched, this one is yung parang pako po na ano, na
Oo, yung
vegetable.
kain, yung seaweed.
Does
Okay.
it improve also yung vision?
So the question if it improves the vision, hindi if it helps with pteridium. Okay. I'm not really...
Correction.
Sorry?
Correction po, pteridgium po.
Sa pteridgium. Okay.
Yes po. Ay, need po ba yung na ripe siya before the operation?
Ayun, yun pala
Get,
yung question.
Okay, okay. Yung pteridgium, there is wala siyang status na ripe. Hindi siya nara-ripe. Okay? It's only the cataract na nagmamature. Yung pteridgium, ang nangyayari sa kanya, unti-unti siyang gumagapang papunta sa gitna ng mata. So, ang pteridgium actually, you can wait before you remove it hanggang sa nag-affect na sa vision mo. But it can have other effects on your eye. Kasi when there is pteridgium, hindi pantay or the corneal surface is not smooth. So when you close and open your eyes, merong areas ng cornea na hindi natatamaan ng tears. Tama, 'di ba? So parang may maliit na bundok na nasa surface ng cornea mo eh. So kapag umulan ng tears, hindi natatamaan yung areas na kailangang tamaan din niya dahil nga may nakaumbok. So it can cause also dry eye and thinning of your cornea. So if matagal na siyang nandyan, even if it's just small, you can have it removed already. But normally, if it doesn't bother the patient, wala namang symptoms, you can wait until it already affects your vision.
Okay, sige. Thank you, Doc. Is that okay na ba? Hello, sir?
Ayos po, okay na po.
Okay, sige. So let's go to the questions from our Slido. Thank you, Doc, for that meaningful discussion. Yeah, let's go ahead and sorry for the background. Somebody's taking a bath. So it's my kiddo. So let's go ahead and discuss yung ating mga questions. So sabi niya dito, Doc, okay. Key, what are the signs and what are some signs or symptoms that may indicate a more serious eye condition, and when should one seek medical attention? Maybe these ones are for those na hindi natin masyadong or hindi natin na-discuss, Doc, no? Or what are the pinaka parang basic on your daily life na bigla mo na lang napansin that you should reach out to eye doctor?
Okay. So actually, basically, eye conditions usually have the same symptoms. But as I said nga earlier, there are parts of the eye that manifest with unique symptoms. So for example, yung retina, no? So when you see flashes of light or tapos may floaters din, so that's an indication that you probably have a problem at the back of your eye. So the retina, when it's tugged or when there are tears in the retina, since it's very thin, no, pwede siyang mapunit eh. Konting traction lang, pwede siyang mapunit. It will usually manifests as parang lightning, parang flashes of light. So when you have those, especially if associated with floaters, you have to consult a specialist already, because that means that you have a problem at the back of your eye. What else? Pag optic nerve naman ang problem, what we usually look for or what the patients usually complain of are decreased contrast sensitivity. So for example, yung color red is hindi kasing intense ng usual red na nakikita mo, no? Kapag there is kapag the blacks are not very blacks and appear as gray, so those are sometimes symptoms of optic nerve damage. Or in glaucoma, for example, which is also an optic nerve damage, what happens with glaucoma is unti-unting nagiging tunnel vision as the disease progresses. So when you have a vision, napansin nyo, parang hindi nyo na makikita sa periphery, or kunwari naglalakad kayo tas madalas kayong tumama sa mga bagay, that means merong problem sa peripheral vision. You have to consult also. What else? Visual field symptoms. So halimbawa, nakatingin ka, may isang part na nawawala, isang part sa gilid na hindi mo makita. That's a visual field compromise. So you have to also check. Have to also go to an ophthalmologist.
So if I got it right, Doc, number 1, no, is yung parang merong flash. Hindi naman ito kapag is this similar to when you look into someone who is doing welding tapos parang pag pumikit
No.
ka? No, it's not.
No naman. Di ba, yung sinasabi mo parang pag kunwari tumingin ka ng matagal sa ilaw and then pag tumingin ka na away from the ilaw, parang nakikita mo pa rin siya.
Yeah, Doc.
That's different. That's ano naman, that's our eyes compensating lang for the light, for the intense bright light that we saw. Pero hindi siya yun. Usually flashes of light is talagang parang flash lang siya, biglang nawawala. Especially if those symptoms are recurrent, paulit-ulit, or hindi nawawala, or progressive, mas lumalala.
Okay. And number 2 is kapag nawawala yung some portions of the peripheral field. And then number 3 is there's a difference between the actual color, no? So you really need someone who has a normal vision to tell you as well, di ba, Doc, na parang iba yata yung tingin mo dyan. Parang red yan eh, hindi yan pink. So something
Sorry.
that...
Additional lang, meron pa palang isa na hindi ko na-mention. When we see things not as it is, we call that metamorphopsia. So for example, kinumpare mo, no, may tinitignan kang bagay. Yung isa, normal, kunwari straight line. Yung isa straight line, and then pagtingin mo sa kabilang mata mo, parang putol siya or parang curved. So that usually is an indication that you have a problem in your macula. Baka merong, yung macula, di ba, is the center part of the eye. Baka may pamamaga doon sa macula. Kaya hindi sharp yung mga images, or kaya may, ano tawag dito? Nag-iiba yung images.
Okay, so meron palang ganyang condition, Doc, no? So that's why it's also very important during our annual physical examination, guys. We have to really follow what the doctor is saying. It's not just like cover your left eye, cover your right eye, and also be more verbal, no? Kapag nagpapa-APE tayo, like what do you really see, or like, yeah, kasi there are times na when you look in a near area bago ka ma-assess, parang alam mo na kung ano yung mga letters, or alam mo na kung ano yung tsura ng lines, or sanay ka na, but let's be more specific kung ano talaga yung nakikita natin. It will really help us na ma-diagnose if ever man meron tayong existing na eye condition.
Usually kasi the doctors sa mga APE, no, just to add, nag-APE doctor na rin kasi ako. what we look for lang as a general physician, not as an ophthalmologist, is what we see from the outside, no? It will really help us screen or really help us to determine if you need a specialty consult if you know your symptoms well.
Okay, thanks, Doc. There's a question that just popped out in the chat. When I sneeze, I see, ano yung sabi dito? May nakikita akong mga puti-puti na lumilipad. Is that normal?
So parang floaters, no? So I have following questions for that. Follow-up questions for that. Ano ba to? Hostero? Mr. or Miss? Hostero. Ilang taon na po kayo? Number 1. Number 2, kung paulit-ulit ba tuwing nagsisneeze? And kung nawawala ba siya kung hindi ka nagsisneeze? Because as we said earlier, yung floaters can be benign, no? So, kung benign siya, it's just your vitreous na lumulutang. Sometimes nawawala. Okay, so kung nawawala naman siya at hindi siya recurring or hindi siya palaging nandyan, that's okay as long as hindi siya dumadami. So I think this is just part of normal degeneration of your vitreous. Baka nagli-liquefy na yung vitreous mo kaya siya nangyayari. But if no other problems na associated yung floaters na yan, no need to consult for now. So kapag napansin mo na lang po na mas madalas, mas madami siya, tsaka po kayo magpatingin.
Okay, sige. So let's go to the next question, Doc. No? Sabi niya dito, are there any eye exercises we can practice for first aid relief?
Okay, so exercises, not really. We only give exercises to patients who have deviated eyes, yung mga crossed-eyed or banlag, no? We call them pencil push-ups. So susundan mo yung pencil, ilalapit mo, tas ilalayo mo. So parang pinu-push up mo nga yung muscles mo sa eye. But normally in patients for preventive measures, we don't really do any or we don't suggest any exercises. So just the ones that I've mentioned kanina. Dun sa tips, wala naman tayong na-mention na exercises there.
Yeah, it just got me curious, Doc, no? Kasi when you say that if you have a very long time na naka-focus sa computer or something very near, tapos to rest the eyes, you have to look further.
Far, yes.
Yeah, far. Parang, is it very particular that you have to look to something green? Kasi, yeah, I hear that all the time.
To something, sorry?
Green, color green.
Color green? No naman. As long as it's far, okay lang. Kasi what you're resting is your muscle. Okay, and the muscle has nothing to do with color naman. So, you only look far because that's the primary position of your eye, na hindi contracted yung mga muscles. So when you look far, you are actually resting your eye muscles. And when you look near, that's when you contract your muscles. So
Okay.
walang kinalaman yung color.
So no need to repaint the room.
No need.
Okay, so next question. It says here, do you recommend menthol eye drops or the Roto eye drops for tired eyes?
Actually, we don't. I'm not sure, no, kasi iba-iba yung consensus. But menthol eye drops kasi, yung Roto, actually, kilala namin yung supplier din yan. Yung supplier niyan, nagsusupply din ng eye medications. But we don't usually suggest, personally, I don't suggest menthol for your eyes because, number 1, it's an irritant. Number 2, if it irritates your eye, it causes dry eye. So baka mas maging problem pa siya in the long run.
Okay, sige. Before we go to the questions here from Slido, meron na tayong mga questions coming in sa chat, Doc, no? So number 1, sabi niya dito, someone is wearing corrected lens, then pagdating po sa bahay, tinatanggal. okay lang po ba yon? No risk po ba yon for further eye damage? Like,
Oo. So, kanina sa myths and facts, no, I think nasagot na natin to. No further damage naman. So, when you remove your glasses, it's the same thing as parang wearing glasses na iba yung grado. Okay? So, ganun lang din yon. When you remove your glasses, babalik sa normal grado mo yung mata mo. No further damage to the eye will happen.
okay. Sige, Doc. One more question from the chat. Sabi niya dito, "Hi, Doc. Nagsuot na ako ng eyeglass to make my vision's clearer. However, after a few minutes, nagiging blurry na rin ang aking vision. Ibig sabihin ba nito na hindi tama ang grado ng aking eyeglass?"
Okay. So, if you wear your glasses and lumilinaw siya initially, most likely tama yan. So, yung nagiging blurry siya intermittently or nagiging blurry siya tapos lilinaw ulit, so you may have other problems with your eye. Baka meron po kayong dry eye na ang manifestation is intermittent blurring of vision. So, you have to have that checked also. So,
Okay.
kasi kung nako-correct naman yung nung glasses nyo initially, then that means it's tama.
Yeah, one thing that I captured kanina, Doc, no, na I was also medyo na ano din ako, no. It's also your position from the air condition.
Yes,
Na
oo.
also
Kasi that's one of
dry eye.
Yes, that's one of the environmental risk factors, no? If currently exposed ka sa wind, exposed ka to any moving air, so electric fan, aircon, mas mabilis mag-dry up yung tears kasi mas mabilis siya mag-evaporate. So you're also more prone to dry eye if you're in that condition.
Okay, thanks, Doc. Ayan, I have a lot of questions coming in sa chat, Doc. Are corrected used to actually correct the grade? On my instance, every year nag-a-upgrade. Yung corrected glasses, Doc, are they used to correct the grade? Kasi in the team members instance, parang taon-taon na lang siyang nag-a-upgrade.
Pwede ko bang itanong ilang taon na po kayo?
Amos Reyes, 28.
28. Okay, sige. So, the glasses, as I mentioned earlier, it doesn't really affect the structure of your eye. And yung grado natin, yung myopia, hyperopia, yung nearsightedness and farsightedness, ang nagde-determine doon is yung haba ng mata. And yung glasses mo, yung glasses na sinusuot natin, it doesn't affect the length of your eyeball. Okay? So, kino-correct lang niya yung kaya niyang i-correct, which is yung refraction. So, yung sa'yo, kung nag-iiba-iba pa rin siya yearly, so tumataas ng konti or bumababa ng konti, but most likely tumataas yung grado mo kaya nag-change. It has to do with the structure of your eye. Hindi siya sa glasses mo. So, baka nagde-develop pa yung eye mo. So, humahaba pa siya or not. So,
Okay.
it has
Follow-up question regarding, sorry.
Sige,
Follow-up
sorry.
regarding that one, Doc. At what age yung pinaka hindi na talaga nagpo-progress yung growth or changes in the eye structure?
Actually, medyo late na nga yung 28 eh. So I think more than hyperopia or myopia, baka astigmatism ang meron siya na nagpo-progress. Kasi yung astigmatism can change just with the shape of your cornea, di ba? So if you have risk factors na can change the structure of your cornea, ayan, sabi niya, yes po, astigmatism. So, ang gusto kong tanungin dyan is do you have a history of allergies? Kasi kapag chronic scratching ng eye, pwedeng progressive yung astigmatism. Or number 2, kapag meron siyang mga innate corneal problems na baka kailangan mong ipacheck. Kasi kung progressive yung astigmatism mo, pataas ng pataas, baka yung cornea mo, baka your corneal integrity is not that strong. Meron tayong mga tinatawag na ganong conditions like keratoconus. Ibig sabihin, lumalambot yung cornea, nagdo-droop siya. So that will cause progressive and severe astigmatism. So kung 28 ka pa lang and then paulit-ulit yung pagpapalit mo ng salamin dahil pataas ng pataas yung astigmatism mo, you have to have it screened for further corneal problems.
Okay. Sige, Doc. For us to maximize lang yung time natin with Doc, no, let's go to a question that is, ayan, galing sa, sa Slido natin. Are there any specific vitamins or supplement that can benefit eye health? I'm not sure if I can add this one, Doc. What are the specific vitamins for the ones who have pre-existing eye condition and the ones na healthy lang, wala talagang diagnosed na case?
Okay. So, eye vitamins, I mentioned earlier, we have lutein. Lutein is the main vitamin for the eye. And sabi ko nga, we can get that daily from what we eat, no? Especially green and leafy vegetables. We also have vitamin A, which is less important but still somehow can maintain good vision. That we see in orange foods naman, like cabbage and carrots. Normally, if you don't have any problems with your eye, we don't really give vitamins because you don't have to have a lot of it. You can already get it from what you eat. So kung nakakain mo na siya, hindi ka na namin bibigyan kasi you don't have to have a lot naman just to maintain your eyes, no? Sayang lang yung ipambibili mo. If you have conditions naman like macular degeneration or if you have conditions na ayaw nating mag-progress, that's when we give the vitamins to you as supplements, no? So there are over-the-counter medications for lutein. So you have to, if you want, kung gusto ninyo, you can PM me, private message, and then I'll give you the name. Kahit naman wala siyang prescription, I'll just give you the name. Pero I don't want to mention kasi syempre may company yan.
Sige, Doc, how can they reach out to you?
Email na lang, ma'am. You can give my email to them.
Okay, sige. So, guys, those who wants to know kung ano yung prescribe ni Doc or ano yung sinasuggest ni Doc na brand or name ng vitamins, no, you can reach out to me and then we can ask her via Google Chat and I'll revert back to you. Okay, so thanks, Doc. For the benefit of time, yung question regarding this issue, I was very particular with this one earlier, no. Sabi niya dito, Doc, before we go to the there are 26 ophthalmic products na binan ng US FDA right now because it was found out na yung insanitary yung paggawa doon sa manufacturing facility, no. So are this also do you also recommend na iwasan natin siya? In terms of the problem, kasi parang nakita ko sa CNN News, no, na the facilities were found to have unsanitary practices. So,
Yes, so usually,
guys, you can check the name of the brands through online na lang po.
yes, so if it's banned by US FDA, most likely it's also banned by Philippine FDA. And usually, personally as doctors, we know naman if those brands are banned or not. So we don't prescribe them to the patients if they're banned. So what we give are FDA approved products, or even if it's not, for example, there are medications kasi na not really used for the eye, but merong side effects sa eye. So those are FDA approved also, and we give those also as well as prescription medications. But normally, if they're banned in the US, we don't prescribe it here also.
Sige, thank you, Doc. For those questions that was mentioned in the chat for specific conditions, I'll reach out to Doc, Miss Flor, for that specific question. Thank you so much, Doc Kat, for an insightful session. We value not only discussion but also feedback. We would love to hear from you guys what you like the most and how we can make our learning sessions better. So drop your feedback through the link below, or you can scan the QR code that is shown in your screen. We really appreciate na we get feedbacks not only for us, but also our speakers are also requesting actually for feedback so that for our learning sessions, we can improve kung ano yung mga discussions natin. And you can also place there in the feedback form kung ano yung mga applicable or kung ano yung mga topics that you would also want to discuss. So once again, thank you so much, guys, and thank you so much to those who joined our learning session. Have a nice lunch. Bye po. Thank you. Thank you, Doc Kat.